everyone. Thanks for coming to the presentation. I'm Cormac Miller, the president of Censinet, joined by Linda Stevenson.
Linda Stevenson, CIO at Fisher Titus Health in Northwest Ohio.
And we got about 20 minutes. We are going to walk you through some early findings of the Censinet healthcare benchmarking study. It's a study we've been doing for the last 3 years for the industry. We've got some high-level findings that we'll share with you. There's a deeper dive we'll be publishing in about a month, but we felt like, given the event and the audience, it'd be good to give you some high-level findings from this year. So, Linda, do you want to talk a little bit while we're waiting? We've got a slide on this. You want to talk a little bit about Fisher Titus and how you got involved with the survey?
Sure. Fisher Titus is a rural healthcare organization in Northwest Ohio, 100 beds, 17 ambulatory facilities. And as you can imagine, the challenges we have are really understanding where is our money best spent, where is our time best spent with related to cybersecurity. So I was really excited to participate with this benchmarking study to really give us a sense of where we're at and relative to the rest of the organizations.
All right, great. And just a little bit about the survey. As I said, this is the third iteration that we've done this for the industry. We've got some great partners listed here on the slide. And this really came out of the conversations we were having with our customers. They were saying, we all do internal assessments, but there's no great benchmark that we can look at and sort of figure out what does our coverage look like versus what we spend. And so we launched this a couple of years, and every year we try to get the word out to grow the end. This year we got 73 organizations that filled out the 3 surveys. And there's basically 3 pieces to it. There's some operational benchmarking. So how much do you spend? There's coverage against NIST 2.0. This year we did a assessment against the healthcare CPGs, given some of the pending legislation. And then we made optional the hiccup survey. And we actually had a survey based on the NIST AI risk management framework that was optional, but we did get some folks participating there. So I've got some results that I can share with you.
I think this slide also highlights Stronger Together, because look at all the organizations that are part of this survey. It's not just Censinet, it's everybody coming together, which is so rare in everything that we do.
Great. Just a little bit of the method behind why we're doing this. I think a lot of our constituents are always talking about, how do I talk to my executive team? How do I talk to the board about investment levels? And so we see folks using this data to do a couple things. One, obviously protect patient safety. 2 is to prioritize investments. Then obviously identify and try to close the critical gaps. And again, I mentioned enfranchising the board. So there's a lot of different options here that folks can participate in. And, we tend to focus on NIST and CPGs, but increasingly folks are taking advantage of hiccup and the NIST RMF as well. So just at a high level, and hopefully y'all can see on the slide, I'll just give you some of the top level findings that we had. Against the NIST 2.0 frameworks, this is the first year that we used 2.0, what we found is that, govern and identify, underperforming versus respond and recover. Just from a relative perspective, I think there's good coverage in govern and identify. And I think what we've been hearing in the last 2 to 3 years, I think the message has been, it's not a question of if, it's a question of when. And so we've seen a lot of investment in the respond and recover category. Linda, I don't know how this tracks with the work you've been doing at home.
Yeah, absolutely. I think that we all know there's a million tools that we can buy to try and protect our perimeter, et cetera. But really the hardest work we need to do now is to prepare our teams for what happens if. And as you said, not only an if, but a when. So the work and the effort around responding and recovering is really so much more important now than ever.
So just a double click, we tried to highlight in red what were some of the areas that relatively seemed to be less coverage, and then where are some of the places that people tended to have more coverage. So I think generally, folks were generally in the 70 to 75% coverage areas. The places that we saw that were seemed to give folks the most difficulty in terms of coverage was supply chain risk and asset management. And this year it's 2.0, so the framework has slightly changed. But every year that we've done this, supply chain and third party has been the area with the least amount of coverage. And I think with asset management, based on some of the proposed updates to HIPAA, that's an area that's going to come into focus. And I think just what we've seen is just the ability to have an infrastructure where you're tracking vendors, understanding who you're using, has been a place where there's, I think folks are trying to get there, make a little bit more investment and try to tie everything together.
Yeah, it's probably one of as you know, the most difficult areas we cover is we can protect ourselves, but we are only as strong as the weakest link in the chain. So how do you get to that supply chain management with not only maybe your direct contracted vendors, but the ones beyond that? And I think it's going to take all of us to get there because we all have to hold people accountable across the entire chain. And this just highlights that, which is nice to see that, we knew where we think we had to go, but it's good to have this confirmation.
Yeah, if you look under Protect, the other area that was on the relatively lower side was platform security. And so this is essentially looking at, are we implementing things the way that we said we were doing it? Are things configured correctly? And I think with some of our customers, especially on both the internal and the third party side, this has been sort of a next level focus of, hey, when we on the vendor side, when we bring somebody in, we said we were going to do X, Y, and Z. Let's follow up and make sure that we're implementing it appropriately and not creating some issues in the way that we're rolling these things out. Linda, I don't know if that's a challenge for you all.
Absolutely a challenge, not only because we maybe have chosen to not do something, but sometimes the vendors don't allow you to do something, and holding those vendors accountable and or saying we're not going to contract with you because you don't have the right platform security is really all part of that as well.
And this should call out some of the areas I talked a little bit about the respond. As you can see, these are some of the highest scores. So again, it's not perfect because last year we were on the 1.1 framework, but there's definitely been what looks like an increase in focus here, and it's starting to show up in the survey data. The other area that I wanted to double click on was the CPGs. So for those who remember, I think back in September when we first started this, there's a lot of talk about CPGs being the vehicle to evaluate organizations on the cybersecurity basics. There's a set of essential goals. There's 10, which are, I guess, sort of the 101. And then I guess that would make the enhanced goals the 201. And so this is data from the 72 organizations. So on the essential goals, I think what we found is that for the most part, everything's hovering around the 80-ish% coverage area, which, tends to be, which is good. Would you expect these are the essentials? So good high performance there. Again, the low watermark there is the vendor supplier cybersecurity requirements. And the number one thing that we hear is, we have a process that we use. How do we scale that? There's a lot of vendors. They need to be reassessed, and it's just a resource issue. And then on the enhanced goals, just a couple of call outs. I would say configuration management. That's sort of a subcategory underneath that platform requirement. So how are we checking to make sure that everything's configured appropriately? And then the other areas on the enhanced that were areas that people relatively seem to struggle with was network segmentation, third-party incident reporting, and the third-party vulnerability disclosure. And again, I think it just goes to the sheer number of vendors that are in play. Linda, I don't know if what your experience is on these.
Yeah, what you're seeing in the enhanced goals obviously is resource intensity, right? Those things take time and effort, and you do it and then you redo it, and it'll be really interesting to see how this evolves over the next year with some of the HIPAA rules that are potentially out there. Hopefully you're all tracking that. I know the Chime Public Policy Group's working hard to say, what can we do? What should we do? Such as asset inventory and network segmentation. I mean, that's huge and really hard to define where you need to stop there.
Yeah, I think we don't have data in here on it, but in the slide, but on network segmentation, if you looked at the hiccup data, of the 10 different areas, the lowest coverage ratio is on medical device security, and obviously network segmentation is a big quote unquote corrective action there. And so I think that's a place where we also see a lot of organizations trying to resource up to address some of the issues around medical devices. Has anyone heard of AI? This was this is the first year we rolled out a version of the NIST AI risk framework, and we put it as optional because we felt like this is an area where it's emerging, and we didn't expect a lot of participation. We didn't know. We just didn't know how far folks were along on the journey. And so of the 73 organizations, 13 filled out the survey. So it's a little bit of starter set of data, but at a high level, I think we found what you would expect is that this is an emerging discipline and folks are still getting their feet underneath them as it comes to managing AI risk. Uh, on the governed side, I think is where folks have made a lot of investments. I'll show you some data in a minute. But the more of the execution, the measure and the manage tended to be lower. Again, it's a small sample size, so take it for what it's worth. But that's what we've seen. And I think we do a lot of work with customers looking at third parties. And the questions that we get most frequently on the front end, I've got here on the slide. So I think most folks are in the process of establishing some sort of a governance committee and establishing policy. Then the next question is, how do we actually understand which vendors have AI capabilities that require additional diligence? And I think really there you're trying to separate some of the marketing versus the, what's actually in the application. A lot of times we're starting to see there's an AI committee where if someone's bringing in a vendor that has AI capabilities, they want to route that information to folks on the committee to get some buy-in and evaluation. I think we're starting to see that as kind of an emerging practice. Then just being able to look across the portfolio, who's got AI, what are they doing? How often do we want to look at this? It's a fast changing discipline. So this might be something you want to look at and reassess more frequently. And then, finally having a process in place where you're going in and sort of reassessing around this. I would say if you ask me sort of the 5 most common things that we hear from folks, this is the sort of the kind of the sort of median, I would say, adoption at this point.
I would just add that I think this framework provides us with some information to go back to key leaders. They all want the AI solution to everything. It's going to solve all their problems, but they don't understand some of the big key things that we have to worry about with regard to AI. So having something like this to go back and share with them is really going to give us a, whoa, let's do this in a healthy way, in a smart way. So I appreciated having this, even though the numbers aren't big right now. The more that participates, the better we're going to be.
Yeah, that's great. And the other thing too is this: as we talk to folks, we tend to have an interface with security teams. A lot of time they're saying there's a lot more subject matter expertise required to evaluate some of these models, and so a lot of the time we're more the quarterback, bringing the right people in to look at this than we are the actual determinant of sort of quote unquote right answer as they would be doing on the security controls. So this is a little tiny just because there's some categories, but I just trying to share some of the subcategories, what makes up those numbers. And you can see on the page, I guess the interesting thing to note is that there was no category where anyone was above 50% coverage. And the place where we saw the highest numbers were one, just establishing the organization, establishing some policies, procedures, and processes. And then at 41%, you've got workforce diversity, inclusion, and accessibility as part of govern. And then when you move down a little bit further into some of the places where you're executing mapping, roughly about 30% coverage, measure roughly 25%, and then manage is roughly about 25%. So I think folks are getting the systems in place, and now they're really starting to put in place the practices that they can execute, start looking at vendors, evaluating, and figuring out what they're going to do organizationally. So just a little bit more detail on the AI category. And then the last thing that we look at across, there'll be a lot more of this deeper dive analysis when we come out with the final report in about a month. But one of the things that we've been a proponent of is working not only across the sector, but special focus on rural organizations and looking at the folks that participate, rural versus non-rural. What is the disparity between NIST coverage? And I think we were encouraged to say that, again, slightly different because it's 2.0 this year, is that the gap is definitely closing. And Linda, I know this is a particular area where you're focused. I'd love to hear your comments on this.
Absolutely. I think that we're all starting to see the buy-in from our board of directors and our leadership, and understanding, as we have the stories to tell that we've all experienced the last couple of years. But this is really nice to see that I think we are closing the gap as a rural healthcare organization with the help of, all of us together. We can get there, but to be able to share this, to say, yeah, we're still behind a little bit, and use this for our leaders to share across all those is really helpful.
So I think those are the numbers, and I feel like every year I come up here, we're encouraged that we've gotten to 73. There's a lot more organizations out there that I think can benefit from the study. We do provide it. There's no cost to participate. It's just time, and we've invested a lot in our platform to make it easy to repurpose. You might have gotten a security risk assessment. Make it easy to get your data in the system. And so I think it's always important just to talk about once you have the data, what do you do with it? And so, Linda, I know this was your first year participating. I'd love to hear a little bit about how you're using the information internally.
And I think you referred to this early in our session today that we all do a risk assessment. And I've always had a risk assessment, and I share that with our leaders to kind of say, here's where we're at. Here's some of the risks that are outstanding. But having the sense of where we're at compared to other organizations really helps them to understand the bigger picture. So preparing board presentations, executive team, buy-in, that's really where I'm going to use some of this. The other piece is I only have a budget. Well, I don't even tell you about the budget. It's sad. But, we have a small budget. We're a rural health organization. So going through this and going, okay, relative to others, where's the biggest gap for me? Where should I spend my money today? I think I might know, but this gives me a little bit more information to go on to prepare, as well as an action plan. So yes, we had our risk assessment, and I'll be taking the two of those together, our original risk assessment as well as this data, and saying, what is our action plan and what are the priorities for us to go into the new year. So it's perfect timing.
It's great. And I think, do you want to talk a little bit about the rural health community?
Yeah, absolutely. Happy to. Obviously, I'm on the bandwagon sharing the plight and the stories of the community hospitals and the rural health organizations. We are really excited that Chime and Nordic and Microsoft have come together to put together a rural health IT community, real official name to be determined soon. But we're coming together to see how we can lead the effort for rural healthcare organizations to share the story, to find advocates that want to help us improve healthcare in the rural health community. Because, our resources, not only people, money, and time, are strapped. So we would like to make sure you all, number one, participate in the survey. First of all, the more we have of you participating, the better. And I didn't know about it until this year either. So I'm telling y'all, go check it out. But then from a rural health perspective, we have a breakfast tomorrow morning. If you're in that world, we'd love to see you come out. We're going to have great conversations, and we have ongoing conversations around how to improve our services, how to improve cybersecurity, how to talk public policy and the impact of regulations, all that. It's free. We just want the conversation to be amongst all of us. So please join us tomorrow morning.
All right, great. And then the last thing I'll put up here is we've, historically when we've done the survey, we've had a tight window where folks can participate. This year, as we've gotten more facile with the study and the data, what we've decided is we're just going to sort of think of it as open enrollment. So if you're interested, if you reach out to Benchmarks at Censinet, we'll get you set up. Again, there's no cost to participate. And literally, once you do the assessment, you have access to the overall letter of benchmarks. You can filter it down to peer cohorts. As long as there's enough organizations to give you a benchmark, we will. And so we're really trying to drive this number up, given I think the benefit it'll have to the industry as a whole. So if you're interested, I'll stand out over here. I've got some cards if you want to reach benchmarks. If you're curious to get a copy of the presentation, just come see me. And I think we'll end this on time. Linda, anything you wanted to add?
I would just add that if you're interested in more about the rural health IT community, Laura is here as well from Microsoft, and myself, happy to take those questions afterwards. And the benchmarking is a lot, but you don't have to. You can pick the CPGs, you can pick NIST, you can do both. Really flexible, but the more we are in this together, the better off we will all be. So I want to thank Censinet for doing it.
No, thank you.